RISE Registry is an incredible resource that the college has. Essentially what it is a database of patients. We take that information from practices across the country that voluntarily contribute the data to the RISE Registry. We aggregate all that data together, and at this point we have almost 1,000 physicians who provide data to the RISE Registry, covering millions of patients with every rheumatic disease there is. And now we are over 30 million encounters that are represented in the RISE Registry. That really serves two key purposes. One is it can help individual practices understand how effective their care is, and we use quality metrics to help practices improve the care of their patients. But it's also a tremendous resource for research. And in particular, for both common and rare diseases, we have large numbers of patients represented in that registry that allow a researcher, to answer questions that otherwise they would be completely unable to answer. The importance of having a new vendor in this space, we've had the RISE Registry for quite a number of years, and it really was built to serve the function of improving the quality of care. But as we think about its importance for research, we realized that there were a number of factors that would be important. For example, the ability to combine the data from the RISE Registry with other pieces of information like Medicare claims data that will allow us to answer different kinds of research questions. And so we really needed to seek out a new vendor both to make the onboarding process more effective and efficient, but also to organize our data in a way that allows us to do some of those things that we've never been able to do before. So our partnership with IQVIA is very exciting because they are a company who has built their entire company based on connections with electronic medical records of every sort and aggregating that data for the purpose of research. So it's a very exciting partnership, and we hope that not only will we be able to answer questions we've never been able to answer before, but that it eventually could be a revenue source for the college if researchers are paying to use that data. Contributing data to RISE has a few very tangible benefits. One is that when you contribute your data to RISE, we help you calculate quality metrics. Some of those quality metrics are used by the governmental payer systems, and so you can actually use your data and your connection to RISE to submit your attestation for those quality payment programs that will improve your reimbursement from Medicare. Additionally, we can provide back to you information about key aspects of quality of care that no doubt you care about, regardless of whether it's impacting your care to your payment from government programs. Because I think one of the things that is absolutely true about rheumatologists is they are passionate about providing the most excellent care possible. And so RISE can really give you insights into some aspects of that care. And lastly, while many private practices may not be doing research in their practice, it is another way that they can contribute to the greater research enterprise by allowing their data to be used to answer new questions. But not just private practices, I think there are opportunities for academic centers too. And one of the other benefits of our new partnership with IQVIA is they have a long history of connecting with some of the larger EHRs like Epic and Cerner that will allow academic enterprises to participate in RISE. And that will give us a much richer array of patients and a greater diversity of population that are contained in the registry.